Hello, this is Dr. Paul Cottrell, and I'm doing a recording on December 20th. So we're going to go over the news dealing with influenza, norovirus, and anything else that's spreading. This is just an update. This is not to scare anybody. There's not a pandemic going on or anything like that. But the thing is that you need to be aware, especially in the United States, of what has been emerging in Australia, in the UK, even in Canada, on how it may affect the winter season, cold season in the United States. All right. So just, it's not to create panic or anything, but you have to be prepared and boost up that immune system and mitigate. And if you do contract something, be vigilant. So we're going to go over especially the H3N2. To prepare for the winter season, take a look at some of the other videos that I have done that will tell you how to boost up your immune system. All right. So right now, this video is going to go over the H3N2 rapidly spreading in Canada. This was published a day ago.
Flu season is different, and doctors say this year's is shaping up to be a beast.
It's now 1 in 5 of all tests that are being done are positive. So that suggests we're right in the midst of that surge.
It's probably going to end up being a more severe and a more significant flu season compared to the average flu season.
Infectious disease doctors say the early spike is driven by the H3N2 strain of the virus, along with
and the worry that I have is the worry that they have in the UK, and that is that it's earlier and it's increasing faster than normal. All right. Now, does that mean peak to peak when you look at a previous year peak that we're just going to peak earlier? Or are we going to surge way past the high point of the prior year? It's 50-50. It could surge way past the prior peak, or it could just peak early. We don't know.
There's probably about 7 additional mutations. Now, those mutations seem to be important because they probably are enhancing the ability of the virus.
It's actually 7 to 9 mutations, depending on which version you're looking at.
Slip through some of our immune protections.
The situation is further complicated by a less than ideal match in this year's flu shot formulation.
The vaccine this year, while it still works, the component that protects us against H3N2 doesn't work as well as we would like it to. The message is, though, it still works, just not to the same extent. And of course, it has good protection against the other 2 circulating flu viruses in the country.
Some flu seasons are a slow burn and last for several months, as was seen in 2023-2024. The 2022 season, however, saw an early spike, followed by a quick drop. Doctors say initial data suggests this year could follow a similar trend, but nothing is certain.
Flu is a very unpredictable virus. So, for example, we see surges like we're seeing now, and then a second blip that occurs in the spring as another type of flu becomes dominant, typically influenza B. What we're seeing right now is influenza A and H3N2 specifically.
The key issue here is prevention. Let's prevent it. So it's important for people to get the flu shot. It's important for people to stay home if they're sick and keep their kids home.
If you're sick, stay home. All right, unless you're having some sort of pulmonary issue or cardiac issue, then obviously you need to be in the hospital. But if you're sick, stay home. It's probably just going to pass within 5 days or so. So it's not a big deal. Most people will be fine. In terms of over-inoculating the population, I am against that. All right, very few people need to be inoculated. All right, and those are the very high risk categories where they have comorbidities, where if they get something, it could push them over the edge and potentially die. So you want to mitigate that, right? But the average person, you don't need it. The problem today is that people are buying in to the idea that you have to over-inoculate. All right, that's wrong. It's wrong thinking. Our population is over-vaccinated. Causes problems with the immune system. It weakens it when you over-vaccinate. Secondly, we have too many physicians that either know better and they know we're over inoculating, or they have fallen into the dogma and aren't willing to wake up and realize that they're over vaccinating. Now, if you go to a physician and keep on pushing for vaccines, why don't you ask them this question? Why is it so common for healthcare workers to be non-responsive to certain vaccines? Because they over-vaccinate. And you can't get the titers up. Like Hep B vaccinations or MMR vaccinations in some cases. We're over-vaccinating the population. The dogma is wrong. It's wrong. And then they make money on it. The physicians make money by issuing these inoculations and over-inoculating, especially in pediatrics. So the bottom line is this: don't over-inoculate. I'm not getting a flu vaccination shot, all right? Neither should you. If you're healthy, But if you have really serious comorbidities, not minor comorbidities, then you may want to think about taking it, assuming that you haven't been over-inoculated. Don't believe in the dogma. If you're healthy, you'll be fine.
They're sick so we don't get people sick at work or at parties or in the school.
Catherine Ward, Global News, Toronto.
All right. So now we're going to go to another video.
All the sufferers.
Because the whole point of this is to see the landscape of how they're publishing this, all right? But there are mutations where H3N2 is a little bit more problematic. There may be more cases, more severe cases, more hospitalizations. We don't know if the peak is going to be earlier or it will be much higher than the previous peak. We don't know yet. All right. I suspect we're going to be a little bit higher than the prior year. And then it'll come down faster. Well, we don't know. All right. And it's okay to say you don't know. All right. Let's listen into NTD. This was 8 hours ago.
Health experts around the globe are now warning of a more aggressive flu season this year. The World Health Organization reports that a new version of H3N2, a type of influenza A virus, has become this season's dominant strain. Back in October, Chinese state media, citing a local CDC, warned that this virus would dominate the flu season. And earlier this month, China's CDC warned that 17 out of 23 provinces are seeing high flu prevalence, while the rest report medium levels. Doctors warn that children are among the most affected groups. Take a look.
According to the latest influenza surveillance data released by the Chinese CDC, severe cases and deaths from influenza A nationwide have increased by 40.2%. Compared with the same period last year over just the past 3 months. In children, influenza A can easily lead to serious complications such as pneumonia, myocarditis, and acute encephalitis.
Chinese media reported a critical case of an 11-year-old boy in eastern China's Zhejiang province. His symptoms evolved from fever to serious pneumonia in just 24 hours. According to media reports, a CT scan shows half of his lung turned white, indicating heavy infection and impaired function in that area. He was
If you don't have a good immune system, you're not going to be able to fight. And this is what I've been saying for the last 5 years. Boost up your immune system, or you're going to have problems. Boost up your immune system. And you can do it. It's possible to do. I tell you every day how to do it. Every day how to do this. All right. I didn't pause it.
We can't. Bacterial infection, from fever to serious pneumonia in just 24 hours. According to media reports, a CT scan shows half of his lung turned white, indicating heavy infection and impaired function in that area. He was diagnosed with severe pneumonia caused by influenza, complicated by a bacterial infection. Here's what other Chinese citizens are saying.
That's the thing that most people need to pay attention to. Most people don't realize that you can't take antibiotics for a viral infection. But if the viral infection takes hold and becomes worse, and you start having pulmonary problems and your pulse ox starts to go down, you can develop a bacterial infection and then you'll need antibiotics. So the point here is that people's immune systems are weakened because of the crisis and because of over-inoculating. So you got to really pay attention, all right? So if things really get worse quickly, you got to go to the hospital, all right? You have to. You don't have a choice. But for most people, you'll just weather the storm at home and you'll be fine. It'll be uncomfortable, but you'll be fine, all right? But if the whole society keeps on inoculating, and it doesn't really cover this H3N2. It's only, 30% or 40% effective for adults. Well, wait a minute here. You're only hurting your immune system because you're over inoculating. You'll notice that people, if they're constantly getting shots every year, you'll notice that they get sick more often compared to people that don't. Our understanding of the immune system and the complexity of the immune system and these feedback loops, especially with over-inoculating, the medical establishment doesn't fully understand what they're doing. They're in their infancy in understanding on how the immune system works. So they're playing around with something they don't really fully understand. All right? So, what do you have to worry about? Well, if you're relatively healthy, most people will be fine. The people that have comorbidities, most likely they'll end up having problems fighting it and have a higher probability of getting pneumonia and a secondary infection that may be bacterial. There will be a small part of the society that's healthy that ends up getting pneumonia and secondary bacterial infections. And you have to be careful with that. Usually when that happens, you're talking about 2 to 3 days into it. All right? So you just watch. But if you get past that 2 to 3 days, eventually you'll start to, fight it and you'll get better. But the key point here is that if you have a strong immune system before you even contract something, you are going to be better off being able to fight it. All right? But if you're constantly relying on some sort of epitope that they get wrong, and it's only 30% effective, and doing this every year is really weakening your immune system, you're not better off. So, why don't you take my advice and just boost up your immune system? All right? Make sure you clean your environment regularly. Make sure that you do proper hygiene. But follow a protocol that actually can boost up your immune system. I tell you what it is. I can't say it in this video because of the censorship. But the thing is it's possible to do. All right? So be aware you can get pneumonia from influenza, and that pneumonia could fester and create a secondary infection that may be bacterial. Most people that contract influenza, taking antibiotics isn't going to help. In most cases. But if it festers and it gives it enough time to allow for bacteria to grow, then it will turn into a secondary infection, and then you will need antibiotics.
Me are getting it. It spreads even faster in schools. At the hospital, you can't even get in line for IV treatment. I got white lung and ended up in the hospital for half a month. There are simply many cases of it.
There are many, many patients in the hospitals. A lot of them still have COVID, And now, the deaths are mostly young people in their 30s and 40s.
We can't predict it. Even a lot of kids are sick. When I look at the virus tests, they carry several viruses at the same time. So it's a co-infection issue, and it's really serious. That's why people think it's especially severe this year.
The Chinese Communist Party has a history of covering up the real situation when it comes to public crises. Many signs are suggesting China's flu season may have started much earlier. In late October, Chinese media, citing the local CDC, warned that H3N2 would be the dominant.
H3N2 seem to have been popping up in Japan, Australia, around June, July, August of this year. And so everyone around the world, it seems as though H3N2 has started early and looks like it's going to peak beyond the previous peak. But we don't know if that's what's going to take place in the UK, Canada, the United States yet. We don't know yet. But it's possible. So there's going to be more cases. And on average, about 50,000 people die a year from influenza. About 50,000 or so a year in a normal season. So maybe it goes up a little bit more, but it's not going to be huge. Now, what you need to really worry about is the aftershock of the crisis of 2020, where you can get the big C, you can get cancer, right? You have an immune issue, either autoimmune disorder or a weakened immune system. There can be early onset of dementia, ischemic, amyloidosis or prion. You can have cardiovascular problems where you have overclotting, microbleeding, microclotting, myocarditis, endocarditis, pericarditis. You can have problems with your nervous system. So there's lots of things that can happen. And this is just the aftershock of 2020. So when the system in the body still is fighting and still, mending from the aftershock of 2020, and then you get hit with H3N2, it's harder to be able to manage it. It's harder to be able to fight it. This is the reason why I keep on saying, keep the inflammation down, control your blood glucose levels, neutralize, soak up free radicals. When you do this, you're helping your immune system.
Rain this flu season. The report also said that southern China was already seeing surging flu activity, but it assured the public that this strain is not a new virus, so there's no need to worry. In other words, China's official report drew the conclusion.
Also, what they're saying is that it's not novel. There's no zoonotic new thing going on. And oh, by the way, nothing leaked out of the laboratory, so don't worry about it. The bottom line is H3N2 is not going to be a pandemic, but it's going to be a worse flu season than normal. And just keep that in perspective. You're going to see a lot of, videos saying the flu season's bad, go to CVS and get your inoculation. You're going to see a lot of that in the United States, at least. Don't buy into it. Don't buy into it. And the society will weather its storm. Approximately 50 to 60,000 people are going to die from influenza this year. Maybe a little bit more, maybe 10,000 more, right? That's a small percentage of the population. But if you continue to weaken your immune system with over-inoculation, more people will have adverse issues, especially in the context of the aftershock of 2020. And why is it
For the WHO.
Why is it that we always have these pathogens coming from China? Well, I know why. Because they're so close to their animals, and there's jumping, especially with influenza. between birds and swines and chickens, and they love to be by their livestock. So just put a dose, take a look at this with a dose of common sense and just vigilance. Boost up your immune system naturally. Boost up your immune system with a holistic approach, and stop relying on the dogma. The dogma is what's hurting people in the long run, not helping people.
However, it withheld some key information from the public. This new H3N2 strain has 7 mutations and could spread quickly and grow stronger. Then, around early November, Canada and the UK started reporting H3N2 outbreaks in their countries. Just 2 weeks after those reports became public, the virus broke out across China. A resident from central China's Shanxi province told us that local hospitals were packed by sick people since the beginning of November. Many people were diagnosed with pneumonia. People started wearing masks again. Many elementary schools suspended classes.
I noticed at some of the physician offices that they're wearing masks for the healthcare professionals. All right, let's listen into CDC warns of subclade K, new flu variant. This is the H3N2 that we're talking about. All right, so this is News Nation. Let's listen in.
Coconut, mango, papaya, vanilla, vanilla, vanilla.
You're joining us now, Dr. Omer Awan, Senior Public Health Contributor for Forbes, to talk about this super flu, subclade K. Thank you for your time. So does the flu shot still make the symptoms of this variant less severe? What should we know?
A little bit.
Thanks for having me, Marnie. Well, the flu shot isn't a perfect match for this subclade K variant that you all are talking about, but it is some protection, and some protection is better than no protection. And that's why it's still critical that we all get vaccinated. And the reason for that is because
30% effective. But you never hear a doctor on mainstream media saying, you know what, maybe we're over-inoculating the population. Maybe we should only focus on the ones that are really at risk, the ones that have serious comorbidities. No, they don't do that. They never do that. Even with an inoculation that's only 30% effective, they have no idea if it's really going to lessen your infection. There's some probabilities, but you most likely have some sort of memory cells of an H3 or an N2 protein to elicit antibodies from prior infections in your life. You probably have had the H3N2 sometime in your life, especially if you've, are an adult. It's a little more problematic if you're a kid because you may not have been exposed to it. So when you have the dogma, individuals promoting the dogma, thinking they know better, but not really like sitting down and like saying, well, maybe not everybody should get it. Maybe we're over-vaccinating the society. You ever thought maybe? What if we are? Oh, then the immune system may be down. Maybe you'll have every other season or every third season it worse because of this, this modulating of the immune system. No, they never say anything like that. It's always like, it's only, it's less effective, but it's better than nothing. Really? What if you're over-inoculated? What if you're doing this year after year after year after year? What about in the context of the aftershock of 2020 and COVID-19? What in that context? What about that? Don't know. Most physicians don't know what they're doing, especially when it comes to psychiatric medicine and the immune system. Most physicians can't fix problems. Most problems that a patient has can only be managed treatment, not a treatment that fixes the problem in most cases. Now, if you break your leg, yeah, you go to the ER and you reset it and you heal, hopefully. You have a cardiac arrest, yeah, you need to, go to the hospital and get stabilized. All right? But are they really fixing the problem? Did they fix your brittle bones? Did they fix your cardiovascular disease? No. They'll put you on metformin if you have diabetes. They'll put you on a statin if you have high cholesterol. They'll bring down your number, but you have side effects from it. You have muscle cramps and other side effects from statins, potentially even Swiss cheese brain. So, do they really fix the problem? No, in most cases. And here's another one. And it's even worse than this. Because of their dogma, they don't even realize that the over-inoculations are actually weakening the society, not strengthening it. That doesn't mean that all inoculations are bad. But over-inoculating, we have no idea what the hell we're doing.
The purpose of vaccination isn't necessarily to prevent you from getting the flu, it's to prevent you from getting sick or to get hospitalized. So that's why everyone, according to the CDC, that's age 6 months and older, should really get this flu vaccine.
Lessen your risk. So this particular variant, what more do we know about it? Are the symptoms the same? Are they worse?
The symptoms are the same, but they're more severe. So you're going to get a fever, sore throat, runny nose, cough, body aches, but they may be more severe. So
the reason why they're more severe is because your body may have some antibodies for it, for a previous infection, but it doesn't match really well. So therefore, it will spread in the body, and before your body needs time to go, oh, this is different. I need to produce some antibodies against it. And as that's happening, it's spreading. And if you have a weak constitution or comorbidities, then obviously it's harder to fight the infection. This is the reason why I would say that you really have to take a look at where your health is. If you're relatively healthy, you don't need an inoculation. That doesn't mean that you can't die from it. You could die from H3N2 even if you're healthy, right? But you could die from it even if you get the vaccine, all right? So, but the point here is that the reason why it's more, quote, severe is that our immune system isn't used to its epitope, the changes that have happened in the H protein, this H3. There's roughly 9 changes. 7 are the more important ones, but there's about 9 changes to it that our bodies aren't used to seeing. And so it takes a little while to fight it. If you have a good constitution, you'll be able to fight it. You'll have a high fever, you'll not feel well, and then it'll pass. But if you constantly weaken the immune system, it's harder and harder to be able to fight these things. And I think this is the reason why that we're seeing more and more co-infections, early infections, faster spread in the society of these different pathogens because we have weakened the immune system in this COVID era. And so this is the aftershock of it. And I've been saying this for 5 years, that this was going to happen, and it is happening. I also said that the cancers were going to blip up. That happened too. I also said that, you know, dementia is going to be a major problem in the next 5 years, especially for people that are over 40 years of age. And then you have autoimmune disorders, and then you also have an immune system that is suppressed, what I call AIDS-like syndrome. But you have to also remember, all those issues aren't just because of the inoculation during the 2020 crisis. It's also because of the actual pathogen of the 2020 crisis. It's both. And that's where the genius is to understand this problem. Too many people are, the ones that are the professional dogmatics, I'll call them, you know, just focused on the actual pathogen. And then you had the anti-vax group that only focused on the inoculation as the cause. Not realizing that, you know, they're both right. You know, a lot of people are saying, oh, myocarditis is caused by the inoculation, which is true. But so is SARS-CoV-2. SARS-CoV-2 causes myocarditis. 100% sure on that. 100% sure. But not just that. Influenza does too. Oh, not just that. There are many different pathogens that cause myocarditis.
Higher temperature, or the muscle aches and the body aches may be more painful. So that's why this is concerning, because it's more severe symptoms, and then it can also lead to increased risk of hospitalization. Sometimes the complications can be worse. So you may have a higher propensity to be dehydrated, maybe more likely to go to the hospital if you get this. So
okay, this is very important for us. This is good information there.
And to try to prevent getting the flu to begin with.
I want to roll back the. Let's see here. All right. States reporting high flu activity: New York, New Jersey, Colorado, and Louisiana. So you have the armpit of the United States, you know, the tri-state area, right? You have Colorado, and then you have Louisiana. So you have it happening in the West, in the Northeast, and also in the South.
This. So very important for us to be vigilant and to try to prevent getting the flu to begin with.
You know, the flu vaccine is already out there and people are getting the shot. Is it too late to add this somehow to the vaccine? How long does that typically take?
It's not too late to get the flu shot. So I recommend everyone out there, if you haven't gotten the flu shot, please get the flu shot. Usually immunity takes about 2 weeks for your body to respond and to form antibodies so that you're protected against the flu. So remember, peak flu season is really January, February, so we're only in mid-December. So in fact, Marnie, this would be a perfect time to go and get the flu shot. So I recommend everyone go and get it.
And I'm also wondering just about this particular variant, how they can add it to
only if you have, this is my take on this. It's my opinion, but only if you have severe comorbidities where it can lead to pulmonary problems or cardiac problems, or dysregulation of your blood glucose levels, like severe diabetes, something like that. So if you have a serious comorbidity, yes, it may be prudent because you have other things that could tip you over the edge and you die, right? So a severe flu infection may be bad. Now, not everybody has severe diabetes. Not everybody has severe pulmonary problems. Not everybody has severe cardiac issues. So the average person, no. All right? But everybody, see, once again, it's the dogma. Everybody. This is a common theme out of their mouth. Everybody. But once they weaken the immune system or something bad, and negative externality happens from issuing mass vaccines, right? It's stupid. I mean, think about it. It's stupid to inoculate everybody with the same epitope, because you just get selection pressure to have the virus mutate in a way to circumvent the antibodies that are created from the inoculation. It's not cost effective to inoculate the population with multiple epitopes. Because if you have multiple epitopes, you're boxing it in and you're reducing the chances of a mutation escape. No, but he's saying everybody, and you do selection pressure. And during that period of time, in a big part of the population, you have a weakened immune system, and you're adding to the weakness of the immune system, leading to further infections. So the point here is not everybody should be getting this. We're over-inoculating the population. It's wrong. It's the wrong thinking. Wrong thinking. Now, does that mean that you might get influenza? Yes. Most people won't die from it. Could it be taking you out of work for 4 or 5 days? Yes. But in most cases, you'll be fine. And on average, there are about 55, 56, 60,000 people that die from influenza annually in the United States. That's the normal take rate. And that's with people taking the vaccine. And there is no signs that it's going to be anywhere way more than that. So I wouldn't do it. For the average person, I wouldn't do it. Unless you have some serious comorbidity issues.
Is that usually a process that will happen after the flu season ends for next year's flu shot to include this variant?
Possibly. What ends up happening, Marnie, is that usually around February, public health experts come and convene and try to formulate the formula for the flu shot. So this is why the subclade K was not in this flu shot, because remember, subclade K started and was detected first in June.
They're always chasing their tail when they're making these vaccines. See, traditionally what it is that the northern hemisphere gets the influenza spread, the cases increase after the southern hemisphere. Okay? The southern hemisphere gets it first, then the northern hemisphere. We in the northern hemisphere will start to determine in February what a particular influenza vaccine should be based on what is known to have happened in the northern hemisphere and what is currently happening in the southern hemisphere. And they make a guesstimation of what they should be covering. It's usually a trivalent, sometimes it's a quadvalent. All right. So that's H1N1, that's H3N2, and then influenza B Victoria usually. In the quadvalent, you also have Yamagata, which is kind of dying out anyway. So I'm not even sure why to take the quadvalent. So the point here is they guess. Now, with AI technology, you can actually look at where the mutations are taking place in the last 3 or 4 years for, let's say, H3N2, and what areas were changing for the H protein, the HA protein. So this H3, so the HA protein, where were they changing in the last 3 or 4 years? Okay. The AI also understands the molecular structure, the three-dimensional molecular structure, and what areas are weak or what areas are stronger in terms of its bonding, three-dimensional bonding. And it can predict where there may be some sort of escape, where it may lead to some sort of immune escape because of this weakness of the topology. Another way to do it is just to take a look. Protein, right, is made by RNA, right? And this RNA has structure, molecular structure. Some areas of the RNA are stronger than others, right? So if you have a RNA virus that it can be mutated, right? Because it's replicating. And when it replicates, it doesn't have a check system. So certain structures, certain RNA structures or certain DNA structures are weaker than other DNA or RNA structures, leading to potential mutations. So the AI can take a look at that topology, that three-dimensional structure of the RNA, and predict what areas may be mutational hotspots in a future mutation. And if that mutation takes place, what that would mean to the change in the three-dimensional structure of the HA protein, because the RNA produces the HA. So you can understand weakness of the topology, and you can also understand the weakness of the RNA structure through AI. And then you do a predictive, have some sort of Monte Carlo simulation. You predict based on probabilities what areas might change. You have a code that you can plug into a vaccine to be able to update, right? So you create a mutation of this virus. There's lots of ways to do this. There's about 4 or 5 different ways, but point is that you can know what the mutations might be in the future and then inoculate. Most vaccine manufacturing, especially for influenza, is not doing that. What they're doing, they're chasing their tail. What was happening in the southern hemisphere? What was happening recently in the northern hemisphere? And guess. And use that as the backbone for the next year's vaccine. All right. So, is that the most effective? This is the reason why they're always behind, because they're always figuring what the play should be based on something that has already happened. So they always are lagging. So that's the reason why these vaccines for influenza are always like 30% effective, 40% effective. Oh, maybe it's 55% effective, and then it goes back down to 30% effective in 1 year. It's only by pure luck if they have a 55 or 60% effective. So the way they pick it is wrong, is my point.
Or the flu shot was actually formed already. So this will certainly be taken into consideration for next year's flu shot, but unfortunately, the actual subclade K is not included in this flu shot, but the H3N2 form is included, and the subclade K originates from H3N2. So this is why there is still some protection, although it's not a perfect fit.
Yeah, get your shot. It's on my list of things to do. Wash your hands. We hear that all the time as we go in.
I mean, I don't know her health. I don't know her health profile, but she is, probably late 40s, early 50s. She probably is around 52, 53. And, I don't know her health. but she looks relatively healthy. She probably doesn't need it. She probably doesn't need it. Now, could she contract it? Yeah. Will she die from it? Very unlikely. But she still has, so if she was going to contract it without the inoculation, all right, and let's say she takes the inoculation and you pick the path of, she contracts it, to mitigate the severity, the effectiveness is only 30 to 40%. So there's a 60% chance or a 70% chance that the severity is going to be roughly the same as not taking it. But she is healthy, so she can weather the storm. It's the people that you got to worry about are the ones that are not healthy. But no one has said that. No one has said that.
What else is your advice for people to stay healthy right now?
Well, I want to start with washing hands, Marty, because not just washing hands, but washing it for 20 seconds. And that's often a message that we don't hear often enough. It's hard to wash your hands for 20 seconds if you think about it. So that's number one thing. But also just avoiding sick contacts, staying sick at home when you are sick, avoiding confined indoor areas. And if you do have to go to an indoor confined area, please, consider wearing a mask, particularly an N95 or KN95 mask. We know that masks help prevent transmission of diseases. And I love that you're washing your hands right now. So that's absolutely great. I love the messaging there.
Do your part, right? Wash your hands. If you're sick, stay home. We can all stay healthy if each one of us does a little bit to help. Dr. Awan, thank you. Happy holidays. Healthy holidays to you and yours.
Happy holidays. Thanks, Maureen.
All right.
Thank you for watching.
All right, 11 hours from the CBC, Alberta, Canada.
It's probably a large snapping turtle. There's only one way to get it. Dive in and hold on.
It feels like everywhere you turn in Alberta, people are getting sick. Health officials say influenza is the main culprit.
They were sick for almost more than a week.
I had a fever for 6 days. It's been absolutely brutal. My partner's actually at home right now, sick.
The province has confirmed flu cases have more than doubled since late November.
Every shift, I have at least 4 to 5 patients who have influenza. 1 or 2 of them will be requiring oxygen requirements. Maybe I saw one patient today that went to ICU.
650 Albertans are in hospital, nearly twice as many as last week. The healthcare system under strain from influenza and other respiratory illnesses.
We're opening surge beds, maximizing available space, expanding virtual care, and safely discharging patients while limiting transfers to high-pressure areas.
Across Canada, the influenza positivity rate is nearly 28%, a jump of 8 percentage points from the week prior. The Public Health Agency of Canada warns hospitalizations are expected to spike in the coming weeks. A few things are making this season especially bad, says this doctor.
This particular strain is a little more virulent than other strains, and the match between our immunization this year and the strain that showed up isn't perfect. So it's a combination of all those different things and a combination of low immunization rates as well.
In Alberta, influenza activity is projected to peak in the coming days, and then the pressure could soon ease up.
And then the hospitalizations would typically lag that by approximately a week. So if we get to early or mid-January, that would be when we would be through the lion's share of the pressure.
As people gather for the holidays, doctors encourage Canadians to wash their hands often, wear a mask around high-risk individuals, and to stay home if they're feeling sick. Julia Wong, CBC News.
If you're a healthcare professional and you're in the theater, if you're in the trenches, all right, you're going to need to wear a mask. That's just common sense, all right? That's a healthcare professional. If you're sick, first of all, you should stay at home unless it's absolutely you need to go to the hospital, all right? You don't go to the doctor. You go to the hospital if it's that bad. All right. And you should be at home for if you contract it typically. All right. Now, when it comes to wearing masks, non-healthcare environment, because in a healthcare environment, you're spreading stuff all over the place, right? Pneumococcal, I think it's called. All right, so pneumococcal spread. But the point here is that if one is wearing a mask, it's because they have it and they're trying to prevent the spread it. All right. In a healthcare setting, it's so easy to spread something that everybody should be wearing. That's just protocol. But it's the individual that has influenza that should be wearing the mask. The ones that don't have it but are around that individual, all right, just in a distance, you're relatively fine, especially if you wash your hands and you stay away from the individual. You don't get that much protection if you're wearing the mask prophylactically outside of a healthcare setting, because a healthcare setting is totally different because you're spreading stuff all over the place. Because think about it, a nurse, let's say, doesn't have influenza, but yet a patient does. That nurse is working up on the patient. She's washing her hands. Each patient goes to another room. All right. She's not washing her clothes, right? She could easily spread it. But in a healthcare setting, it's really important that everybody is wearing, all right, just as an extra precaution. But what really is happening is that the mask is to prevent the spread of the individual that has it onto others. But you don't get that much protection from if it's prophylactically. That's the point I'm making. Especially if it gets on your clothes. And then you rub, if you rub your clothes in a certain way and you rub your face, your eye, or ear, or whatever on accident, you can spread it. Easily spread it. So I don't think that masks really do enough to actually protect. Now people would say, well, what about, the H5N, the N95 masks or whatever, what? You have a little bit more protection, but you still, again, is your eyes protected? Is your ears protected? No. Okay. Just so many stupid people out there. Okay, let's now switch to another virus that is floating around. That's the norovirus. This is becoming problematic in New York. Noro.
What is really great about June and Truffle is they complement everything. I love how you can even see here how beautiful it blends with the cap.
Is on the rise as the holidays approach. The highly contagious virus spreads through contaminated surfaces, food, and water. CBS News medical contributor Dr. Celine Gounder is editor-at-large for public health at KFF Health News. Good morning. Health officials say that this highly contagious norovirus strain is behind the rise in these cases. So what more can you tell us about it?
So we're seeing a new strain circulating, and every time you have a new strain, whether it's norovirus or the flu or COVID, people don't have as much immunity to it, and so you're going to see more cases as a result. What we are seeing is this norovirus season started a little earlier than usual, but November to April is usually norovirus season. And big picture, we think it's going to be a fairly average season.
Symptoms, and why do you think the risk is so high now?
So symptoms include diarrhea, nausea, vomiting, but what we really worry about are symptoms of dehydration. So might be less urination, darker urine in infants. You're not seeing as many wet diapers, but some other warning signs to look for, especially in infants, would be sunken eyes, decreased tears, and things like irritability or
now think about that. If you have diarrhea, you have runny stools, and you're losing a lot of your water that is in your intestines. So obviously you're going to be dehydrated. So it's really important to drink water, have some electrolytes in your water, or like a vitamin water, something like that, or even just adding some sugar and salt to water, maybe some lemon juice. But the point here is that electrolytes in hydration because of the diarrhea. This will last for about 2 days, roughly 2-3 days.
Infants especially at risk? You mentioned that.
Infants are, but also the elderly, as well as people who are immunocompromised.
So I know you're going to say this, but what can people do to protect themselves? I mean, I just came in. I'm constantly washing my hands. Is that rule number one and perhaps the only rule?
Well, we all learned the most important rules in kindergarten: washing your hands. So that is important, but it's
Norovirus is contagious. All right, you can easily get it. Easily get it. Think about public bathrooms or bathrooms at at work, right? Really problematic. Really problematic. If you have someone that's just starting to have the problem and they're having diarrhea at work, right? They could be spreading it on the toilet seat.
sanitizer. For norovirus, you really do need to use soap and water. If you've been sick, you should be staying home for at least 2 days after your symptoms improve, and don't be preparing food for other people until 2 days after your symptoms improve.
We got the news yesterday that the federal funds are going to be cut to the American Academy of Pediatrics. They're clearly very upset about that. Why do you think that's happening? What exactly does it mean?
Yeah, what we're hearing is that HHS is citing identity-based language, so racial disparities. And we do know there are racial disparities in a number of different issues. For example, rural kids and their access to healthcare, access to early autism and hearing screening, which are some of the programs that are being cut here. Others include fetal alcohol disorder prevention programs, teen mental health programs, and
maybe you should just stop over-inoculating adolescents and pediatrics patients. Maybe we should get these kids off of their phone, stop doing the social media. Maybe the kids should go outside and play football, baseball, hockey, run around, be a kid. Less video games, go sledding if you have snow, whatever. Maybe just good old-fashioned raising the kid the way it was in 1980, 1970, 1960, 1950, maybe even 1940. Maybe we should try that. Instead of doing all these early screenings and saying that your kid has ADHD or is autistic or whatever. Once again, here's a classic example of what I mean about physicians. Now, there's a difference between people that have done clinical research, right? And understanding the mechanisms and how to, have treatments or solutions to a disease. Doctors will understand what a disease is. Then the next tier of doctors will understand why it is happening, the underlying mechanisms, which is fewer physicians. And then there are very few physicians that actually are in clinical research. And it's the ones that are in clinical research that know what they're doing. They understand. She isn't one of them. She is the first tier. Can you diagnose? And what do you prescribe? Could she literally do a protein analysis of HA? I bet she can. I bet she can. I can. Shit, I know how to weaponize influenza. Any researcher that knows molecular biology, it's commonplace to be able to weaponize something like influenza. These doctors don't know how to do it because they don't have the research experience. They don't understand the bench. Celebrity doc, right here. Celebrity doc. Giving you basic bullshit that you already know. Your grandmother, they didn't go to medical school, knows more about how to solve this issue with chicken soup than this clown.
To prevent SIDS, sudden infant death syndrome. So how do you ensure safe sleep for infants?
Right. You said racial disparity, they don't like the language that's being used? I don't follow. What do you mean?
Yeah, just even saying that or acknowledging that there are racial related disparities is a controversial thing right now.
All right, Dr.
It's also a reality, though.
Yeah.
It is a reality.
Thank you so much.
The course of this disease is.
All right, let's listen into CDC Chicago.
There is a new warning about a highly contagious stomach virus that is spreading across the country. Health officials say cases of norovirus, commonly known as the stomach flu, are surging nationwide as the holidays approach. Joining us now to talk about that, Dr. Sharon Welbel, the chair of infectious diseases at Cook County Health. Doctor, thanks for being with us. I know some friends and a couple of family members who have already been hit with this, and it sounds like a rough go.
It is a rough go.
What can people expect?
All right, can you see that? Yeah, you can see this. This doctor, it's not very well lit here. She puts her stethoscope around her neck. That's the #1 way to spread disease. It should be in your pocket. She's not even following proper hygiene protocol. But they put it around the neck. You know why? Because it's some sort of like social signaling that they have an authority. Now, you don't need to do that to have authority. All you need to have authority is not a degree. It's truth. It's logic. It's realizing what you know, what you don't know, and how you know something. If you understand that, you have the high ground. You don't have to put your stethoscope around your neck, which spreads infection.
A few hours as far as symptoms go, and how does this norovirus play out?
Yeah, so norovirus, there's so much of it. So I'm not surprised that you know some people that have it. About 20 million people get it in the United States every year. And we have about over
20 million people get it every year. I didn't know that number. But the thing is it's a lot. And I noticed that it's happening in New York a little bit earlier, maybe a little bit more than normal. It lasts for about 2 to 3 days, and then you're fine. But you got to make sure you won't be able to eat because you just don't feel well. So you're expelling fluids because of the diarrhea. And what's going to happen is that you need to pay attention to your electrolytes, and you need to pay attention to your hydration, right? But eventually, it passes. All right. So anyone that has had the stomach flu, that's norovirus. All right, so you know what that means, right? Now, if you are an individual that's on medication, let's say heart medication or diabetic medication, because of the dehydration, because of problems with the kidney, because of expelling fluids through the diarrhea, you might not be holding the concentrations of your medication properly, and that could cause adverse side effects. So individuals that have heart problems are on diabetic medication or other medications that you need to keep those concentrations up, it's going to be problematic. All right. For those people, you need to pay attention to norovirus. All right. If you heart disease, diabetes, or other medications that you may have that you have to maintain a certain concentration level. All right? So be careful with it. Now, if you are not on medication, or you don't have any severe problems, comorbidities, then norovirus, it's going to be uncomfortable, but you'll pass it through and you'll be fine. All right? But it's painful, it's uncomfortable, and you have to make sure that you are hydrated and you maintain those electrolytes. Vitamin water is a perfect way to do it. Another way is to take water, mix a little bit of lemon juice, add some a little sugar and a little bit of salt, and that should be good enough. Another way to do it is to take a 50-50 mixture where you take filtered water and 50% Coca-Cola and shake it.
Um, 2,000 outbreaks every in the United States. And the good thing is that it's generally self-limited. It has an incubation period of about 12 hours to 48 hours. And if somebody does get it, it lasts about 1 to 3 days. People can expect vomiting and or diarrhea. It's predominantly thought of as a vomiting disease, but many people also get diarrhea with it.
Tough. Because of that, I have been washing my hands nonstop. What other things can we do to make sure that we're healthy through the holiday season?
Yeah, let me
every day, bring down inflammation. Every day, soak up your free radicals. Every day, detoxify your body. Every day, invest in your body to boost up your immune system. And when you do that, you can weather the storm a lot better. Because guess what? When physicians have a really good immune system, and they have a lot of patients that are sick, like with norovirus, and they do the proper hygiene protocols, those physicians don't get sick. Amazing.
Preventative measures. So this is a virus that doesn't have what we call a lipid envelope to it, like COVID does and influenza. So the hand sand that we keep in our pocket to clean our hands doesn't work on this because it's got this really strong protein structure called the capsid that covers it. And so we can't kill it with a chemical, but we can kill it with some vigorous rubbing of our hands and hand washing. Really do it for a good 20 seconds. So that's number one. Always keep your hands clean before one eats. Keep surfaces in the house clean. The way we're going to get it is either human to human. So, somebody we know has it, or we're going to get in touch with some contaminated material. So always keeping our hands clean. If you have somebody sick at home, really keeping the counters clean. I like to stay clean and then disinfect.
Smart.
Clean it off.
You might want to take a look at some of the products that are on the-studio-reykjavik.com. Might help you out. I'm pretty sure they will. They help me.
Use the dilute bleach to disinfect it. You can use like a third cup of bleach to a gallon of water and let it sit there for 5 minutes. You want to clean your vegetables and fruit really well. Eating raw oysters and shellfish can also be a problem because they are often contaminated with this virus. So, and it's also really pretty resistant to heat. So things have.
Stay away from the shellfish.
Heated up to over 145 degrees Fahrenheit.
I see.
So all of those things are good preventative measures.
Great. Thank you for walking us through it, Dr. Wellbell with Cook County Health. We appreciate your time.
My name is Cecilia. I'm a mom of 2 girls, a psychologist, and I choose to transform my KBC treatment journey with Ikerva.
Now think about it. It's an intestinal virus.
Hello, I'm Matt Galloway, and this is the current podcast. It is being called a super flu.
There is a new warning about a highly
All right, that's 6. This is 1 year. 10 days. 4 days. 100 months. Okay, so we're gonna let me just pontificate here for a bit, and then I'm going to switch to another video. Intestinal flu, all right, norovirus, all right? People say it's the intestinal flu. What it is norovirus, right? So with norovirus, it involves the intestine. So if you have a good gut biome, if you maintain a healthy mucosal layer in your gut, if you maintain IgA concentrations, a type of antibody in your gut, you are less susceptible. See, when your gut biome is not working right and that mucosal layer starts to shrink and your concentrations of IgA start to go down, guess what? You can contract things in your gut and hence have problems. But if you have a thicker mucosal barrier, if you have IgAs, if you have a better gut biome, if you have less leaky gut, if the cells in the colon are protected, you have a less chance of getting an infection. And that's why I keep on saying good health starts at the gut. I've been saying this for years. And with the bad dietary practices in the United States, the SAD diet, the standard American diet, it's actually weakening the gut and increasing your probability. And then lots of people eat shellfish and have a bad gut. And eventually, oh, guess what? Norovirus starts to pop up. Now, why is it that norovirus pops up on ships, on cruise liners all the time? They have a buffet. And those buffets usually have shellfish. And you're concentrated in a small environment on a ship. And you're bumping into people and you're spreading stuff. People are not washing their hands properly. They already have a leaky gut. They have a poor gut biome. And all of a sudden, voila, a bunch of people get norovirus on a cruise liner. All right. Next. Let's listen in. This is one day ago, dealing with NBC New York.
Lysol knows when the whole house is sick, your laundry is sick. Adding Lysol laundry sanitizer kills 99.9% of illness-causing bacteria detergents leave behind. Clean is good, sanitized is better.
With Christmas just 1 week away, doctors are warning everyone about a so-called triple-demic surging across New York. According to Northwell Health on Long Island, cases of RSV are up 35%, while COVID cases are up 15%. But the flu is hitting the hardest, with hospitalizations spiking 75% in just 1 week. Health reporter Jenna DeAngelis has what doctors are now urging to keep yourself healthy this holiday.
It's the holiday season, which means we're not just spreading Christmas cheer, but unfortunately, respiratory viruses.
You know, a lot of people are getting the flu. My daughter says that she's had a ton of friends who've had it, families had it. It's, I guess, been a rough season for the flu.
I got COVID like 2 months ago, and I have had it before, and this was by far the worst.
The triple-demic is upon us. Cases of flu, RSV, and COVID have spiked since Thanksgiving in New York, and doctors expect...
Now, why is it getting worse? You should have had cross-reactive antibodies. Oh, people's immune systems are weakened, especially if you over-inoculate. Not just with COVID shot, but also with other shots, like influenza. People's immune systems are trashed. Wake up. Wake up. I've been saying this for over 5 years. And because of the immune system not working well, and some other dynamics like inhibiting P53, people start getting cancers. Amazing how that works. And because of the immune system is down, there's more inflammation that's building up, especially at the neuron level, the microenvironment. You have microclots and microbleeding and chronic inflammation around the neuron. The neurons start to die. Early onset of dementia starts to set in. Have you noticed that a lot of people in your community, in your circle of friends or at work, are doing something like this, and then they say something that seem like they're lost for words, or they lose some sort of thought. I'm not talking about like a complex, argument that has like 15 different tentacles, but just a typical conversation. Can't find the word. A lot of maybe even some behavioral issues. This is a sign of the aftershock of COVID.
Trend to continue with more holiday gatherings.
Flu is rising a lot faster than it did last year.
The latest statewide data shows there were nearly 1,400 flu hospitalizations the week of December 6th, a 75% jump from the week prior. Northwell Health, which typically cares for 2,800 hospitalized patients on a given day, saw 3,500 Thursday.
Remember, our numbers vastly underestimate how many cases there are out there. Very few people get tested.
The triple test is what we recommend.
This self-swab is available at Northwell labs or physician offices to test for all.
I think a triple test to understand what you have is really important. And also to understand, are individuals getting multiple pathogen infections? All right. Because usually what happens is that, especially with a viral infection, is that part of the innate immune system will shut down. I have lots of videos about this going back 3 years ago, all right, when I was doing the whiteboard stuff. What happens is that the immune system is signaling to other cells. The cell gets infected, and there's a signaling process to tell surrounding cells to go into a antiviral mode and go into a pre-apoptotic state. So if they get infected, they die off quickly. And that's how it kind of slows down the spread, right? So usually what happens is that it takes a more virulent pathogen, and that outcompetes lesser pathogens, and those lesser pathogens die out because of this early apoptotic setup, right? That's part of the innate immune system. Now, if the innate immune system isn't working as well, there are higher probabilities of having triple infections. This is what I've been saying for a long time. Part of the aftershock of the 2020 crisis, due to a weakened immune system, will be triple infections, double infections, secondary infections, which is very similar. If you pay attention to advanced stages of AIDS, there are pathogens that are normally broken up by the immune system that are no longer, because the immune system is trashed in an AIDS patient. And so different diseases pop up, different pathogens start to pop up. See, we're bathed in pathogens But if you have a good immune system, you fight it. But if you have a bad immune system, you can contract stuff very easily, depending on the level of severity of a weakened immune system, on top of cancers that pop up. This is the problem that is happening in the aftershock of 2020. If you don't boost up your immune system, you will have a problem. And I've been saying this for 5 years. So now you got a triple issue going on. And you keep on pulsing the immune system with over-inoculation, and you're just exacerbating the problem.
Three viruses at once.
Scan the barcode on the swab and then drop it into a box that gets delivered to our lab.
We toured Northwell's core laboratory where more than 37% of PCR nasal swabs tested came back positive for a subtype of influenza A last week. Doctors say the vaccine this year is not a perfect match for the new strain, but it still makes a difference.
The vaccine does help keep kids out of the hospital.
I've not seen a death in somebody who's been vaccinated, and I have seen plenty of deaths in people who have not been vaccinated.
Flu season typically stretches into early spring, so
My worry is that the dogma is going to weaken the immune system because they keep on thinking that everyone should be inoculated. And first of all, it is a bad idea to inoculate the whole population or a large part of the population with the same epitope. Because when you inoculate the whole population with the same epitope, you're increasing the escape mutation.
say it's not too late to get your flu shot. Jenny DeAngelis, CBS News, New York.
Doctors also stress the small steps that can make a big difference. Wash your hands, and if you're sick, wear a mask and avoid holiday gatherings. Jenna is our health and wellness reporter. If you have a story idea for her, just scan the QR code at the bottom of your screen.
What is a day in my life actually like?
All right. Let's see. Anything else that's 4 months ago? All right, this is a interesting one. This is from Australia. It's 4 days ago. Old researchers find COVID alters brain tissue. Really? Interesting.
Queensland researchers have discovered significant long-term brain alterations long after COVID infections. Scientists from Griffith University compared the MRI brain scans of people who had been infected with those who hadn't, finding evidence that symptoms do persist. Alterations to actual brain tissue was also found, suggesting COVID could leave a silent but permanent effect on brain health.
All right, and I'll tell you why that is. It falls into 3 different categories. Microbleeding and microclotting leading to ischemic brain tissue destruction. Overinflammation can also inhibit your ability to break up misfolded proteins. And chronic inflammation at the neuron level, surrounding the neuron or within the neuron, will increase the number of proteins that are misfolded. Now, when these proteins have a series of beta sheets, they can stick together and over time accumulate plaque. And it's hard for the neuron to be able to break up those plaques, either the plaques that are building up within the neuron or on the neuron. All right? Sometimes you can have enzymes that are secreted that can break up plaques. But if it reaches a certain critical point where there's enough of the beta sheets sticking together, you're not going to be able to break it up because the enzyme isn't big enough. Now I've done a little bit of research on modifying certain types of enzymes to be able to break up plaque. All right? But there's nothing out there really that's effective on the market to be able to break these things up at the commercial level yet. So this is all research level. But the point here is that you can do, you have high levels of inflammation in or around the neuron that leads to further misfoldings that leads to plaque buildup inside or outside of the neuron. When that happens, the neurons start to not communicate as well. That will lead to neural death. And the neurons don't communicate, you start to have recession, less communication, and the neurons start to dwindle and die off. So you have the ischemic that leads to neural death. You have a buildup of plaque or amyloidosis that will lead to neural death and dysfunction. And then a very small subset of the amyloidosis is a buildup of plaque, of misfolded proteins that actually are prion disease. So, but that's a very small percentage. That's about 0.1%. But over time, when you have this inflammation, you can actually see the amyloidosis, the tissue destruction, or the ischemic problems. Prion disease, it'll be a little, I don't think you can see that unless it's really severe on an MRI. But the thing is that you would be able to see more advanced or moderate level of amyloidosis, and you definitely would see the ischemic. So it's about inflammation, because even the microclotting, the microbleeding for the ischemic is heavily predicated on inflammation. So if you keep the inflammation down, you're reducing the chances of these pathologies to emerge. This is why I keep on saying inflammation, 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 inflammation. Now, we've listened to, 6 doctors that are on mainstream media, and not one fucking one of them said keep inflammation down. Not one. Not one. Not one. Not one. Now, they didn't say it in this, but many doctors, or even when you go to CVS, they say, well, get this inoculation and take acetaminophen, if you have pain in your arm. When you do that, you're eating up your glutathione. You're reducing your glutathione pathway. And when you do that, you're increasing inflammation. So you're actually increasing the chances of vaccine injury by taking acetaminophen, because you're eating up the glutathione that you need to keep inflammation down and soak up free radicals. So it goes back to sports medicine, geriatric medicine, anti-aging medicine. Inflammation and free radicals is where it's at. You bring that down, you do better. Not one of those doctors said that, because they think the more antibodies that they pump in your body, the better off you are. Well, if that's the case, why don't you just inoculate the whole population with antibodies every day except on Sunday? Because they know that if you do that, something bad really happens to the immune system. So they're playing with something they don't fully understand, but yet they'll tell the whole population to do it. And you couple it with a toxic environment, especially in the food supply, and I think it exacerbates the problem. It increases the inflammation, wrecks the gut biome. Got to look at this from a holistic point of view, because if you don't look at this from a holistic point of view and couple allopathic, which is standard medicine, Western medicine, with a more natural approach, and you couple those two together, That's the secret sauce. If someone says only allopathic, wrong, 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 wrong. If someone says only natural, wrong again. It's a coupling of the two. When you couple the two together, that's where the secret sauce is. And it's about prevention. Because once you start having a problem, the doctor can't fix it. Once you start getting the amyloidosis and you start seeing in your MRI scans some sort of plaque buildup or some sort of tissue damage because of COVID, it's too late. They can't fix it. Once you have myocarditis and you have micro scarring in the myocardium, it's too late. They can't fix it. It's prevention. Prevention. Lower the inflammation. Lower the free radical. And when you do that, you're helping your body to be weathering the storm. Because if you're full of free radicals and you're chronically inflamed and you happen to get norovirus because your gut biome is terrible, do you think you're going to weather the storm very well? Or what about RSV? Or what about COVID? Of course not. But if you have a better constitution, if you have a better gut biome, if you're controlling that inflammation and it's brought down to normal levels, if you're controlling your free radicals and you're keeping them down, do you think you'll weather the storm better? Yeah. The answer is yes. Shake your head, yes. Not one of those doctors said that. Not one. Not one of them. That's my show for this particular item. If you want a more comprehensive way of how to deal with this problem, make sure you pay attention to my videos. I tell you in detail what you need to do. It's what I do. You'll be way better off if you pay attention to what I have to say and not these clowns that are on mainstream media. Thank you for listening and have a nice day.